Well, it's about that time. Welcome everybody to our monthly live pet Q&A. My name is Jordan Swain. I am the customer service manager here at Real Mushrooms, and this is the beloved Dr. Rob Silver. Hi, Doc Rob.
Hi, I'm Doc Rob, Chief Veterinary Officer for Real Mushrooms. Happy to be here today.
We're happy to be here, and we are here to take your questions. I do want to open up a little bit and kind of let you guys know we do have a little promotion going on special for this Q&A. I'm going to go ahead and share it here. You can use the discount code PETLOVE25. You can see it right here. I will also share it in the comments. Once we get going and talking about tonight's topic, you'll have a clickable link to go ahead and take advantage of that. But it's 25% off site-wide until April 30th. So with that said, Dr. Silver, what are we talking about tonight?
Well, I'm just trying to get the camera adjusted so it looks like I'm looking directly at you, but maybe that's the impossible dream. Tonight's topic are beta-glucans. And beta-glucans are really the secret sauce in mushrooms, although they have a lot of different sauces. But it's the main secret sauce that everyone talks about in terms of the mushroom's ability to improve the immune system of our pets and of ourselves. And I just wanted to give a little background on that because I think that the more you understand how mushrooms work, the more you're likely to want to use them and the more it will benefit your health and your own pet's health. And so it goes way back, millions upon millions upon millions of years, back when animals were only single-celled organisms. And it turns out that both fungi and animals both evolved from the same single-celled organ ages and ages and ages ago. And fungi have been some of the most pathogenic organisms there are. And so early on, and as they split into different families, the fungi started attacking the animal cells, and the animal cells developed an ability to fight the fungi by early recognition. And so the beta-glucans are actually part of the fungal cell wall. The function they serve in the fungus, in the mushroom, is structural strength for the cell wall. There's beta-glucans that are strong, and then there's the chitin, but we're not going to talk about the chitin today. And so the cell wall of the fungus has these little beta-glucans on the outside, and when an animal cell would contact that outside of the fungal cell wall, it would recognize the beta-glucans as being possibly a threat of that fungal organism, and it would mount an immune system response. And as animals developed into multicellular organisms and developed immune systems, it turns out their immune systems were signaled whenever they would come in contact with a beta-glucan shape, they would get stimulated to work better. So, and that's good if you're an animal, as we all are, and you're in contact with fungal pathogens, because they're some of the worst that are out there and the most difficult to treat. But what's interesting is mushrooms are not pathogenic, but they've got these same beta-glucans that pathogens have. So when an animal is fed a mushroom and fed the beta-glucans, it trains the immune system to be more vigilant than if it hadn't gotten that beta-glucan. And that's basically the simple mechanism. There's a lot of other things that beta-glucans can do, and we may wind up referring to them as we get the questions, but I wanted to keep this as brief as possible because I know that the question asking is a really important part of what we're doing here tonight, and bring it on. I'm ready.
I actually have a question for you first, Dr. Silver. There is a certain name, and I have heard both you and Joni refer to it, but what is it called? It's like there's a saying called how the beta-glucans kind of wake up and activate the immune system.
It trains the immune system is what we call that. And or perhaps it stimulates increased immune system vigilance against pathogens. But what we have found is with continued, and this is one reason why we recommend that mushrooms shouldn't just be given as a one-off. Give it one day a week and you're going to be okay. You need to give it more consistently. And when you give it consistently, it actually trains the immune system to work better. And it does some other pretty interesting things in the body, like it goes to the bone marrow where we have all the stem cells, for the immune system. These are the parent cells that then divide and clone into the rest of our immune system. And the beta-glucans actually have an influence on these parent cells and can change them. And by changing them, it makes the immune system more effective. I think that's what you're asking, right?
Yes, that was what I was asking. There you go, folks. Beta-glucans.
Beta-glucans.
Here.
Can't live without them.
That's right.
Okay.
And so, Dr. Silver, we're going to go ahead and do your disclaimer.
Yes. So I really want to give you as much information as you can to help with your pet's health, but I want to make it clear that we don't have a doctor-patient relationship, so I'm not really giving you specific medical advice for your pet, although it may actually sound like it, that I'm just talking about how these theories can apply to your pet's problems. So that's I want to be ethical about it. And, there's so many details with each pet's problem that to just give me a couple of sentences doesn't really give me enough information as a veterinarian to truly be effective for you as in a medical context. So, but I'm here for you.
Yep, that is right. Okay, so we're going to go into some questions. This question asks, are high doses of beta-glucans better for addressing health issues? Can you give too high a dose?
We've not found any problems with very, very high doses of beta-glucans, but we do know that the greater amount of beta-glucans that you're giving is appropriate for more serious diseases. So this is why if we're talking about cancer in a pet or chronic infections that don't seem to be resolvable or fungal infections, we recommend pretty high dosages. This is if we're recommending wellness, we recommend relatively low dosages. And so that's when I get all these dosage questions. That's one of the things I think about when I'm giving you advice, is not just the weight of the animal and the potency of the product, but also what are we treating.
Yep, exactly. And we'll go ahead and move on here to the next question. So how exactly does turkey tail help pets with cancer? I read many testimonials of how it helps them live much longer than oncologists had predicted.
Well, turkey tail contains higher concentrations of beta-glucans than any other mushroom. So for one, you're going to get more with an equivalent weight of mushroom of turkey tail versus another mushroom. But it also, I want to make it clear that there's not just one beta-glucan. Beta-glucans are actually compounds that are made up of multiple sugar molecules. And the sugar molecules are connected in such a way they're not digestible. And the classical beta-glucan has all glucose sugar in it. But what we find is when beta-glucans have other sugars in them, or if they have these cross branches, that they are more potent in terms of stimulating the immune system, because it's the immune system that actually defeats the cancer. It's the beta-glucans that make it effective to do that. So there are over 17 different beta-glucans in turkey tail, and it's a higher quantity in general. So that would be how turkey tail has gotten the reputation over hundreds of years of use by indigenous peoples and different ethnobotanical systems to be good for cancer or for difficult infectious diseases. There are other components in the mushroom other than beta-glucans which also have anti-cancer properties, things such as triterpenes or nucleosides. And so turkey tail has the most of all of those. And so it's really good for cancer. And that's why we recommend it. And oncologists tend to be, I love oncologists and I'm not putting them down, but they have to be very very specific with what they're looking at, and they have to see specific evidence in order for them to make the kinds of predictions that they do. And there's not enough scientific evidence out there, except a couple of studies with turkey tail, that really oncologists can use to be smarter about the use of mushrooms. So give them some time. We'll get some studies out there, and pretty soon many more oncologists will be recommending mushrooms such as turkey tail for cancer.
Wow. I didn't know that there were 17 kinds of different beta-glucans in turkey tail. Is that true for every mushroom, or is that just turkey tail?
Well, all mushrooms have multiple different types of beta-glucans, some more than others. Some have more branching than different types of sugar molecules in it. And it's all those different aspects of the beta-glucan molecule that speak to how effective it can be for treating cancer. And apparently some mushrooms are better for some kinds of cancers than for other. Turkey tail seems to be generally effective, but I would probably use other mushrooms if I had cancer in certain tissues.
Wow. I'm telling you guys, working with real mushrooms, I learn something new every single day, and I just learned something. So,
well, I have to say, working for Real Mushrooms, I learn something new every day too. It's an amazing company to work with because there's so many knowledgeable people here. We've got such great we've got Mason, who's a naturopathic physician. He's on our staff from Canada. We've got Lee Carroll, who's a medical herbalist from Australia. I mean, I get to speak with these guys almost every day, and I learn from them, and then I share that knowledge with you.
And we also have you, Dr. Silver. Don't forget that. We've got you.
Me too. Me too.
All right. So we'll move on here. Can female dogs take mushrooms when they are pregnant? I know we had a question about this from a customer earlier this week, so I feel like it's good to address it.
Well, mushrooms are edible, and mushrooms are part of our food. And so probably it's safe, but as a company, we can't recommend that and as a veterinarian, I've always been very cautious, and I used to do a lot of breeder work. I did artificial insemination, things like that. And you just have to be careful because the pregnancy is a very delicate time, and sometimes something that you might not even be aware of can interfere with the successful outcomes of a pregnancy. And if you're giving something for which there is not good evidence of safety during pregnancy and something happens, then sometimes it gets directed towards the company or towards something they've added, such as mushrooms. So we can't as a company recommend it, but shiitake mushrooms, they're part of our food chain. And so I think that, and I'm very cautious about recommending anything for a pregnant animal. And if you were, I would recommend very low dosages, and just as a wellness thing. I'd probably say, unless you have a specific reason for using a mushroom in a pregnant animal, I would just avoid it, just to be on the safe side. You've got 63 days of gestation. It's not very long to be off a mushroom. So I would say you're probably better off being safe versus taking a risk.
Yeah. Yeah. It's better to just play it safe
and
not do it. Next question here. Best supplement for a 14-year-old German Shepherd. No cognitive problems, just arthritis in the spine affecting the back legs. About every 8 weeks, she gets a GI upset as well. Thank you.
Well, there's several mushrooms which have been found to have some analgesic benefit. I wouldn't use a mushroom as a standalone for arthritis, but I would use it, or for pain, but I would use it as a partner in a program. And for instance, something such as cordyceps, is known to have a very good amount of analgesia, as is maitake mushroom, as is reishi. So I would probably look at those. Our 5 Defenders, which has the maitake and has the reishi in it, doesn't have the cordyceps, it's a nice combination formula, and I would say that's not a bad place to begin.
Yeah. Best of luck with your German Shepherd. My neighbor has a German Shepherd, and he's starting to get some of that hip dysplasia.
Well, 14, that's actually pretty good for a Shepherd. And their conformation is such that their hips are tilted, and so they do have that increased tendency to have a problem there.
Yeah, absolutely. Next question. Hi, I just had a question about how much to use. I have a 5-year-old female Rottweiler who weighs 78 pounds. and was diagnosed with osteosarcoma in late January. I've been using your turkey tail and chaga.
So you want to give as much as the dog will tolerate, short of having digestive upsets, which can happen. And, the turkey tail and chaga are also both in the 5 defenders. So you could just give them both with that one capsule, But at 78 pounds, I would suggest probably somewhere around 2 to 3 capsules of the 5 defenders, or two to 4 capsules of the turkey tail and chaga. We don't really have specific dosages, but I would want you to give quite a bit of that, starting with a lower dose and working your way up to make sure there isn't any specific issues with your animal with those. Chaga is good for the digestion, and there's nothing wrong with just using the straight turkey tail and chaga either. I would probably go, maybe like I said, two capsules of each twice daily. I think as long as you don't have any side effects with cancer, especially with something as nasty as osteo, I would try to push it as much as you can.
Yeah. Best of luck with your Rottie. My 10-year-old lab was just diagnosed with mast cell cancer. What mushrooms could help him?
Well, we know that reishi and chaga both, which are also both in the 5 defenders, have these terpenes in them, which will stabilize the membranes of mast cells to reduce their ability to release the histamine, which is part of how they create their symptoms. So, and they also have good content in terms of beta-glucans, which will help to stimulate the immune system to try to eliminate or downsize or reduce the growth of the mast cell cancer. Not all mast cell cancers are the same. They grade it into 3 different grades based on, they have to do some special testing on it. It's a good idea to have that done to give you an idea of just how aggressive it is. Mast cells can be extremely low aggressive and no return after you remove them, or they might show up someplace else also lowly aggressive. But we can also see lowly aggressive mast cells convert later to more aggressive ones. So it's always good to keep vigilant of that, and to also do that testing to find out what degree of aggressiveness it is, what grade is it. But 5 defenders is the answer.
Got it. Perfect. Sorry, guys, if I look like I'm spacing out, I'm also doing all the comments and going through everything and posting them while we're on here. So
we've used to have 3 of us here, Joni, and so then Jordan was in the background, kind of the wizard behind the curtain, pulling all these levers. But now Joni's gotten very busy with other things, and so now we're just doing the 2 of us, and we can do it. But that's what Jordan's doing, talking about there.
Joni will be back next month. So. All right, we'll go ahead here. Next question. Can mushrooms help a dog with Cushing's disease and sludge in their gallbladder?
I don't know. I think the Cushing's disease is possible. We're looking right now at cordyceps because of its benefit to the adrenal glands. The sludge in the gallbladder, typically when I've seen a patient that has that kind of problem, that really the only way you could determine that's with an ultrasound, and that's probably what they were doing, looking at the adrenal glands and trying to determine what kind of Cushing's it was. I've always used a milk thistle product because silymarin in particular is known to thin the bile and also to cause the gallbladder to contract. So I would use a combination of milk thistle, which is also good because with the Cushing's disease, the adrenal glands are producing an excessive amount of corticosteroids. That's steroids, like prednisone, only it's the body's own creation, and those can have an adverse impact on the liver anyway. So it's a really good idea to do some silymarin with Cushing's. Good idea for the sludge in the gallbladder, and I would suggest looking at reishi, which also has a benefit to the adrenal glands, as does cordyceps. Reishi and cordyceps are the 2 adaptogens amongst the mushrooms, and adaptogens are very beneficial to the adrenal glands. We don't have studies that are supporting that, treat Cushing's with these mushrooms as a way of treating it or curing it or fixing it, but I think that they can be very helpful for the symptoms. And right now I'm doing a study in horses, because horses also get Cushing's. using cordyceps, because some of my colleagues who are holistic equine practitioners have been observing that horses that have Cushing seem to benefit. Their hair coat gets smoother. They seem to have better attitude, less thirst with the use of cordyceps. Now, we're giving them a full tablespoon a day, as compared to the relatively smaller amount that a dog might get, half a teaspoon to a teaspoon or so.
I'm really excited to know the outcome of that study.
Yeah, I know. They're supposed to take the second blood tests this month, so hopefully we'll have some answers.
Yay, that's awesome. We got a follow-up gallbladder question. Jennifer is asking NAC for gallbladder.
I don't know that I would use NAC. NAC stands for N-acetylcysteine, and it's a nutraceutical. It's really a synthesized and isolated molecule. It's very similar to whey globulin protein, which has cysteine in it, and both of them can stimulate glutathione in the liver as an antioxidant. We use N-acetylcysteine a lot for frank liver disease, but I'm not familiar. I don't think that it does anything with the gallbladder. I might be mistaken, but it's a good thing. It's inexpensive. It's very inexpensive. It's well tolerated, easy to give, and I think it's a great nutraceutical to use when we have liver disease.
Yeah, I've heard of it. I've heard of its use in the liver for sure. So that's good to know. So moving on to some live questions.
We also use it for pancreatitis, by the way.
Oh, yep, that makes sense. Funny Verse is asking, do you mix it in their food or are there treats?
Well, we have two products, and one is in the works for a third product that are soft chews. And soft chews would be considered to be treats, although we can't really call them treats because the FDA thinks that it's a thing. But about, is it a food or is it a medicine? And the FDA says you can't call them treats, so we call them soft chews. So yes, we do have it in soft chews, but yes, it's we want this to be given every day. For a long period of time. It needs to be as easy as possible to get it in them. And so, yes, I do think that it's good to mix the powder in with the food if it won't dissuade the animal from eating the food, or just burying the capsules in something so that they'll take it in the capsules. Reishi, for instance, is pretty bitter, and some animals will accept it, but some won't.
Yeah. I was going to say, I've been experimenting with Stark's food. He gets all kinds of mushrooms, and I have found that he will actually readily available. He will take a capsule of reishi, and I don't have to hide it in anything anymore because he loves his food so much.
Oh, interesting. Nice. So you just put the capsule in the food. Yeah.
Put it on the top and he eats it. So.
Yeah, Ollie gets suspicious of me. He's got PTSD, and so he knows now when I try to give him a capsule hidden in something, he can actually, even in something sticky like cream cheese, he's actually able to separate the capsule from the cream cheese. So now what I do is I open the capsule and I mix it with some yogurt, and he's good with that.
That's good. He's not suspicious then.
No, he likes yogurt.
Kathleen is asking, can dogs have intolerances to mushrooms or allergies to mushrooms?
Yes, they can. It's not common, but people can too. And we do field comments in customer services, which Jordan is in charge of, from both people and pet and about their pets regarding what are apparent sensitivities to it. This is why I suggest that whenever you start with a mushroom, you start with a low dose, and do it for 5 days or 10 days or some reasonable period of time in order to see if there is a reaction. Because if there's a reaction to a small amount, it's much easier to get rid of it when you stop using it, versus you give a whole bunch, you get a bigger reaction, and then it takes longer for them to recover from that. But yes, they can.
Yeah. In customer service, we usually are recommending that people start with a smaller amount, especially if their dog has never had mushrooms before. Sometimes you just want to err on the side of caution.
Mm-hmm. Yeah, there's actually papers written about shiitake and human sensitivity to the shiitake mushroom, and if with fresh mushrooms that have spores, the spores are almost like pollen and very small, and so they can also stimulate immune system reactions.
Gotcha. And there's a follow-up question to this one. What type of reactions would you see if an animal was allergic to mushrooms?
Well, I think that can be pretty individual, but I think diarrhea is probably the first thing, or lack of appetite, or soft stools. But there's no reason why we couldn't see hives, or rashes or redness, or even upper GI vomiting. But those are very, very uncommon. I think the most single common complaint we get is diarrhea or soft stools.
Yeah, absolutely. Thank you for your questions, Kathleen. Move on here. I love raw mushrooms. Thank you. We do too. My dog is on turkey tail and reishi and gets it daily for mast cell tumor. I want to get her on chaga as well, but she has a history of urine crystals. What other mushrooms are good?
Well, honestly, I mean, and I don't know what your dog's medical condition is specifically, but the chaga that we make does not have the oxalates in it that perhaps you're concerned about regarding the urinary crystals. We have two types of crystals in dogs depending on the acidity of the urine. One are oxalate crystals, which would make it seem like maybe giving chaga is not a good idea, and the other are the struvite crystals, and they're also dependent upon the pH of the urine. Um, so the chaga is good for the mast cell as well. Um, and I would say you could probably use the chaga, or you could go with the turkey tail reishi and chaga in a five defenders context, which puts it all together for you, and just give a higher dosage, of that, so you can get enough of both or all three of them in there. But I'm really not that concerned about the adverse influence of chaga on urinary crystals. And we have there is a study somewhere that shows it's beneficial with urinary tract infections, not crystal based, but infections.
Got it. See, learning something new every day, guys.
There you go.
Move on here. So Jennifer is asking, I started 5 defenders this week for myself and my 12-pound cat. Is there a time frame to see any benefits?
Well, I guess it depends what benefits you're looking for. Some of the benefits that we see with mushrooms can be very subtle and very nuanced. I mean, how do you know your immune system's doing better until you're challenged? But in general, we do hear from people, and I've experienced this myself, that there is kind of a sense of well-being that mushrooms in general can create. So looking at that sort of a response, I would say 2 weeks would be a 2 to 4 weeks would probably be that sweet spot where it's on board enough to be able to have enough of an influence to benefit something.
Yeah. And would you say that, just kind of going off that question, would you say that that 2-week time frame would be a good way to maybe tell, okay, do I need to increase the amount I'm giving, or kind of see how things go? I'm just asking as devil's advocate.
I do. I think that you could start increasing it sooner than 2 weeks, if you're, if, in terms of the mitigation of side effects, diarrhea or allergic reactions. But in terms of benefits, probably need to go a little longer than the amount that we would use for side effects, which would be shorter.
Got it.
That makes sense. Yeah.
No, makes sense. Yeah.
Okay.
Figured I would ask. I feel like that was a good follow-up question. Best of luck, Jennifer. And we'll move on here to Patty. We have adopted 2 5-year-old Shih Tzus from an abusive situation. Have them on Daily Dawg and 5 defenders, but being a small breed dog, what other mushroom can I give them to help strengthen their lungs and trachea?
So they must have a little bit of that collapsing trachea, harsh cough. And obviously they're quite stressed as well. So I would suggest the cordyceps on top of what you're doing there. Because neither the dog nor the defender has the cordyceps in it. And the cordyceps is specific for the lungs. And earlier, when I was mentioning that certain mushrooms might be better for cancers in certain tissues, in my mind, I was thinking, cordyceps for the lungs, or cordyceps for the kidneys. So I think, and cordyceps is also known, even though it does increase our energy in a very nice way, it also has that same kind of benefit to calming and mental situations. Now, there's a lot of options here. Let me keep going. So I've created a treat which might actually be good for dogs that have come from an abusive situation and may not be like my Ollie, that happy about having stuff given to them all the time, especially in capsule form or things that change the taste of the food. So we do have these soft chews, these mushroom relax chews, these guys here, which have, there it is, two mushrooms in them, reishi and lion's mane. And lion's mane is really good for stress, really good for anxiety, but it also has tryptophan and theanine from green tea and taurine and valerian and calming herbs in it. Something like that, especially if you've just adopted them, these chews could be very helpful as far as helping them make the transition to your household. And another option would be just simply to add lion's mane itself to their program. So I think we don't have. Oh no, we do. I'm sorry. We do have the cordyceps and lion's mane in the dog.
Yes.
But I think that you may need higher levels for that, and so you might want to augment that with some additional lion's mane. Now, both lion's mane and cordyceps are very tasty. Some people say lion's mane is somewhat like lobster. Some people say cordyceps is somewhat like kind of a nice toasty kind of a taste. So they should go very well in the food and maybe even improve the taste of the food, depending what you're feeding, of course.
That's right. And talking about the soft chews, Daily Dawg, everything here, it's a good reminder that we actually do have a promo code for you guys to use on the website. It is exclusive to this pet Q&A. The discount code is right here, PetLove25, to get 25% off your order. This is a site-wide discount code, and it is active now through April 30th. Mm-hmm. And I will go ahead and share a link in the comments so that you guys.
Is that case sensitive? Does that have to be all caps for it to work?
Yeah, it just has to be spelled correctly with the 25. I think that's
good. I know with my website where it's very case sensitive, and a lot of people don't know that, and we get these, the code's not working,
Yeah, no, but I don't think it's case sensitive, but if you want to play it safe, do it all capital. But yeah, site-wide 25% off, so you can get mushrooms for both you and your pets. So this is a good time to stock up, 25% off. Take advantage of it now while the offer is hot. And we will move on to some more questions. Let me see here. Okay. Valerie is asking, my 76-pound Shepherd / lab mix takes Daily Dawg. Do I have to add anything else other than that?
I guess what you're not saying is why you're using it. So the intention that I created the Daily Dawg with was to be a kind of a once-a-day meal topper to provide probiotics and microbiome support and wellness support, but not to necessarily have high enough levels to address frank disease. So if your Shepherd lab is, healthy and taking it just for the wellness, then I think you're good with that. But if you have other needs, then we might want to layer on something maybe at a slightly higher dosage to address that specific need.
Yeah, hope that helps, Valerie. And if it puts any context for you, I give my dog Stark Daily Dawg every day. And then I also give him additional reishi and chaga and 5 defenders because he is an allergy dog and it does seem to help. So nothing wrong with layering on extra mushrooms. And we'll move on here to Jennifer. Is there a certain mushroom recommendation for FHS in cats? What would that say?
Sensitivity syndrome, and it's an unusual neurologic condition in which the cat's skin just seems to crawl, and it's actually, I think it's a form of epilepsy, kind of a petit mal sort of a thing. It'd be almost a behavioral type of an epilepsy. I don't think we really have a good handle on it, and it's such an unusual condition that I've got no clinical reports from any pet parents that have been using it in their cats, and I haven't been able to apply it to any cats with that. But if I were to use a mushroom for that, I would use lion's mane, because lion's mane has such a benefit to our nervous system. And lion's mane, and particularly for a cat, it should be fairly easy to get the powder into the cat. Because with cats, that's always a challenge. Not just what's the right mushroom, but how the heck do we get it in them in enough amount in a large enough amount for a long enough period of time to make to provide benefit. And so when lion's mane or cordyceps are the answer for cats, I think we're in like Flint.
Yeah. Hope that helps, Jennifer.
Mm-hmm.
And we'll move on here to Natalie. So this is a 3-part question, but I'm just going to summarize it in this one comment. She said, I started my dog on turkey tail for UTIs. She is 20 pounds, so I give her 1 capsule a day. Would that be enough?
Turkey tail, did you say UTI?
Yes.
Okay. And so a 20-pound dog probably is getting the pet-sized capsule. And I would say that's a good place to start. And hopefully you're doing some other things for the UTI other than just a mushroom, because mushrooms aren't really specifically like for UTIs, although I did mention chaga is a possibility as well. So I would start with the 1 cap a day, and it may be supportive enough, to help. If you're having recurrent UTIs and the antibiotics just don't seem to be doing the job, my suggestion is to use the cranberry. Maybe you need to use more cranberry, or there can be other issues why. Yeah. Oh, sorry. Okay. Thank you.
Yeah. No, I was gonna. Yeah. It's yeah.
Yes, so the recessed vulva is a reason, because they get urinary retention. They could also, and the urine kind of sits on that vaginal floor, and then it gets contaminated and then goes retrograde back up the urethra, that very short urethra from the, from the vaginal antrum to the bladder. So yeah, I would say, yep, maybe try two capsules a day, 1 twice daily. Do that. Yeah. See how that works, and if that's not helping, and I feel your pain. I've treated many of these. Sometimes the surgery, as much as we hate that idea, can really help, where we kind of just do a little plastic surgery to stop that from being recessed. I've done a lot of those, and you might have to bite the bullet, but let's see if we can manage it medically first.
Yeah, I hope that helps, Natalie. Best wishes to you and your little one.
Yeah.
We'll move on here. My 10-year-old lab mix is going great quickly, and some bumps are showing up. What do you recommend? She's taking turkey tail, but it seems to make her tired.
I'd go with the cordyceps on this. I think the cordyceps has some anti-aging properties as well. In Chinese medicine, when the hair turns from black to gray, we see that as a blood deficiency, which is part of the aging process. We don't make blood as well as we age. And I think cordyceps would be a good partner here for that, and especially if you're seeing, I'm not sure why the turkey tail is making her tired. I think I've heard a couple of complaints from other people that somehow the animal has a reaction to a mushroom which makes them tired, or maybe quiet, or maybe they've been hyper because they're having a problem that the mushroom solved, and so then they calm down. I'm not sure. Obviously,
Right.
you don't have that doctor-patient relationship to look at the lab and know everything else. But
Right.
yeah, I would say give cordyceps a try, and you can go for the pouch, which is more cost effective. You don't have to give capsules, and you can just scoop. Lab's probably 50 to 75 pounds, so maybe scoop a half a teaspoon twice daily in the food, half to 1 teaspoon twice daily. See how that works.
Yeah. Well, I hope that helps.
Mm-hmm.
And we'll move on here to Pat. She's asking, what's the difference between powders and tinctures? Is one more effective than the other?
That's a very good question. We've recently posted a blog on this topic that's very technical and is worthwhile reading. It's got much more detail in it than I can cover today. But basically, powders are more potent than tinctures. Tinctures, because they're liquid, so much of them are made up of the liquid itself, and most mushrooms are not very soluble in water. Beta-glucans are not very soluble in water, except for certain from certain mushrooms. Maitake beta-glucans apparently are more soluble in water. So you don't need very much powder as compared to how much tincture you might need for an equivalent dosage. And because the powders in general are pretty palatable and you need such a small amount, it's fairly easy to hide them inside the food, so that the issue of tinctures being easier to give is really off the table. And in my own experience and the experience of my clients, oftentimes tinctures aren't easier to give if you're giving it directly to the animal, because you've got to chase them down. You've got to get them still enough. You've got to be able to open the mouth, get that tincture, squirt that in there without contaminating the tincture, the glass pipette tip. And if you do, then you have to rinse it off with water first, because you don't want to put that saliva back into that bottle of tincture. And if the tincture is made has vegetable glycerin in it, vegetable glycerin is not a very good preservative for microbial growth. And so if you are putting it in the mouth and getting saliva on it and then putting it back in the jar, it's possible that there could be bacterial contamination growing in that vegetable glycerin. So we've had big debates here at Real Mushrooms about whether we want to create tinctures or not. And we think that our current powders are very potent. We really think there are the the gold standard really for medicinal mushrooms, and we think that they're very well adapted with pets. Now you can take that powder and you can mix it in with something tasty, maybe some bone broth or something, and use that to kind of syringe in or just put on top of the food that way, if that would make it more palatable and easier to give.
I hope that helps, Pat. I did share the blog post.
Thank you.
In the comments so that you guys can check that out. Our very own Joni Kamlet put it together, and she did a wonderful job.
She did a great job.
Very detailed, very wonderfully written blog post. So definitely check that out. We'll move on here to Bridget. She's saying, I have an 80-pound Doberman, and he has a fatty bump on his left rib cage. I give him 2 500-milligram pills of 5 Defenders. Anything else I should give him?
Bridget, I've not been able to see any kind of benefit to the fatty tumors that you're describing, which is what we call a lipoma. It's a benign mass of fatty tissue, and probably is due to the preservatives in pet foods and the toxins that we're exposed to every day, and that sort of thing, hydrogenated fats, processed fats and oils. So I'm not sure that what you're doing is going to work. I'm sorry. And for an 80-pound Doberman for a tumor, that's a pretty small dosage if it's just 500 milligrams. So if you want to try to see if this is going to work, then let's use a higher dosage. And I would probably double that. I'd give 4 capsules twice daily. I mean, that's 80 pounds. Start with 2 capsules. You're doing 2 capsules once daily, it looks like, or maybe 1 twice daily. So double that to begin with. Make sure he tolerates it, as we've been discussing. And then if that's okay, do some more. But unless it's a huge lump, it's going to bother you more than it's going to bother your dog. When we see these fatty lumps like around joints or things that move, that interferes with movement, that's a reason that we use for removal. But for sheer cosmetic value, I generally recommend against doing that. It's just not really necessary. And unless you can get all of that fat out there, and oftentimes they're actually in a capsule and they kind of come out like a little jellyfish or something, they sometimes will return as well. So yeah, they're and you might want to check thyroid status as well, because sometimes we'll see problems with fat metabolism with hypothyroid, and Dobermans are not uncommonly a breed that can get that as a problem.
That is very interesting to know. All right. Well, I hope that helps, Bridget. We'll move on here to Only in Paradise asking, does giving the powders over extended periods of time elevate kidney or liver enzymes?
Not that we've seen.
Okay.
If anything, they might reduce them, especially whichever one you are using. Like reishi would be really good to reduce liver enzymes. Cordyceps would be really good to reduce kidney enzymes. I've got a good study with cordyceps where it actually shows a reduction in creatinine with the use of cordyceps. So no. And I think there may be some spin out there about there's something wrong with the powders or whatever, and maybe that's what's underlying this particular question. And we triple check our powders. They are analyzed by third-party labs as well as by ourselves. We're very proud of how clean and how pure our products are, and they're used by MDs. They're used for practitioners to treat humans who have very serious conditions, because the practitioners realize how clean our stuff is, how good and potent it is, and reliable and consistent in its potency.
Yeah.
We've been doing this 30 years. We know what we're doing.
It was for a long time.
Mm-hmm.
We're not new around here. All right, so we'll move on to Judith. Judith says, my 90-pound GSD, 2 years old, is eating 100% nutritionally balanced, gently home-cooked food. He thinks he's 4 months old again, along with the high energy levels. Is there any mushroom that will slow him down? That's an interesting question.
Yeah. So he's young. 2 years old is not very old for a German Shepherd. What do you call him? Tiny?
Right.
So, I guess if you wanted him to settle a little bit, try lion's mane. Why don't you see what lion's mane does there? I'm not sure this is really a problem. I think maybe it's more your problem than your dog's problem. But try lion's mane. See what that will do. Maybe that will sort of calm down his energy. I mean, there may be more at play here in terms of his activity levels than just the diet that he's on, his breed and age.
Yeah. I think that's a good thing. I don't know. Maybe my point of view is that I think that's a good thing. When I switched Stark to fully home cooked food,
Mm-hmm.
he's turning 7 this year, and he suddenly he got this burst of energy. It was great. And now he looks so good. He acts like he's younger, like he feels better, I can tell. So maybe this is something to celebrate, Judith. Maybe this is a good thing.
Shepherds need a lot of boundaries. They need a lot of instructions. They need a lot of training, and it may be that that's kind of what he's asking for.
Yeah.
That he needs to have some structure, and there's no structure, so he's not contained. And that's one reason they do so well as police dogs, as guard dogs, as attack dogs. Not that they're vicious, because they're not. They train really well. They listen to commands very well if you can get that started with them. And at 2 years old, if you have not started it yet, it's not too late. Get moving with that.
Yeah. They love to have a job.
They do.
They're
working dogs.
Yes, they are. Move on to Lynette here. So she says, I have a 4-year-old female Aussie with incontinence. She is currently taking
It's a form of estrogen.
Okay. Is there a mushroom that would help her?
I would probably try the cordyceps here. Cordyceps has been shown to actually increase 17-beta estradiol, and that may actually have a supportive benefit. I don't have clinical evidence for this, but that would be the choice that I would make, would be cordyceps for urinary incontinence.
And then Lynette also had a follow-up saying that she's also a very nervous dog. So perhaps maybe the relaxed chews, or maybe lion's mane.
And so nervous dog, urinary incontinence, maybe she even has some some stress urination, when you come home and she gets excited and kind of rolls on her back and then urinates. That's not an uncommon problem. So yeah, that's where looking at something like the relaxed chews or the lion's mane might help settle her. You might want to look at a CBD product that can also help with nerves as well. But and some training, and some boundaries also help with nervous dogs as well. They like to have a job. They like to know where they're supposed to be, and that where they are is okay.
Yeah, that's generally what most dogs, they just like to have some sort of job or the boundaries, and
yeah, they do
to help. So we'll move on here to Kathy. Can you get a lipoma to shrink with mushrooms? I know we kind of just addressed this one, but my senior lab has one on her rib cage. Can you overdose your dog on mushrooms?
No, you can't overdose your dog with mushrooms. The rib cage is a very common site for the lipomas, and I assume that you must have listened to what I had just been saying before about that. But no, you can't really overdose your dog on mushrooms unless they're sensitive to them.
Yeah. And the nice thing about, our products is mushrooms are a food. And so they're very inherently safe in that way.
Mm-hmm.
Move on here to Victoria. She's saying, if I'm giving my dog 5 defenders, can I also give cordyceps? I'm currently giving my dog a bit more than 1/8 of a teaspoon, and it's less than 1/4 teaspoon.
I think you're going to be okay there. You're not telling me the size of your dog. I assume it's pretty small if you're doing 1/8 of a teaspoon. We're recommending around 1/8 of a teaspoon per 10 to 20 pounds of body weight per day is kind of a starting place. So yeah, no, absolutely. No problem there. And you might want to look at the Daily Dawg. Maybe switch to that, which has the cordyceps in it. If you're for a small animal, you might get everything you want right there. It has the 5 defenders, and it has cordyceps, and it has lion's mane.
I'm going to go ahead and share Daily Dawg in the
Sure link.
So you guys can go check it out if you would like to. It's a fantastic product. Stark loves it. He gives it 5 paws up. 2 paws up? Yeah, that's it. We'll move on here. So many questions. You guys are awesome this evening. Brooklyn 53 is asking, my 23-pound cat had total ear ablation surgery last year for a cancerous mass in his ear. Currently giving him 5 defenders of 2 capsules and cordyceps 1 capsule a day. Can you suggest anything else?
Well, 23-pound cat. Okay. I'm very impressed that you're able to get those many capsules into your cat on a daily basis. We're trying to prevent this cancerous mass, whatever it was, from reoccurring. So I think you're doing well, actually, quite frankly. And I think you're giving plenty, for this cat. So good question, thank you. But I think and I appreciate your motivation and wanting to do as much as you can. And I think you are doing quite a bit. So feel good about your care for your pet.
Yeah, and that's very impressive that you're able to get those many capsules in a cat, just a capsule in a cat in general. I mean, that's great. And if that is him in the picture or her, it's very cute.
Oh yeah, nice little tuxedo cat.
Yeah, they're so cute. My sister-in-law has an orange cat.
That's one that you're allergic to?
Yeah, but he's very cute though. His name is Dexter.
Okay.
He's adorable. We'll move on here. Patricia Willis is asking, what mushrooms for skin issues, regrowth of fur from lesions?
Okay. Well, there's a mushroom that we haven't discussed much called tremella that is very good for skin issues. And we know that lion's mane itself is also very good for wound healing. But oftentimes I'm not quite sure what the skin issues were to begin with and why you have the loss of the fur. So I can only give you a kind of a general answer here as far as the mushrooms that I know that benefit the skin itself. There may be an answer that lies within the diagnosis, the dermatologic diagnosis. Is it an autoimmune disease? Is it allergies? Is it, what is it? That would have, a different set of answers or additional recommendations.
Awesome. Sorry, I'm responding to a couple of comments.
Sure.
We'll move on here.
Lots going on. How many people signed up today? How many people do we have on here?
Not a lot, and we've had at least 80 people watching at all times, which I think is a record.
Nice.
So,
we're starting to gain some steam here. That's good. I'm glad that in part my advice is generating more interest and hopefully the sky's the limit. We're just going to keep going with this.
Absolutely. We've been doing the pet Q&A for 2 years now.
Wow, 2 years.
This month is 2 years.
Wow.
It's crazy. Yep. We'll move on here to Jennifer. Hello, sorry if this was already discussed. Don't be sorry, Jennifer. Is there an option for helping dogs with kidney or liver issues? One specifically has stage 4 kidney failure, a GSD that is 2 years old, looking for extending time with him. Another GSD male, 1-year-old with double FHO. Anything in general to help? Thank you.
Well, yeah, for your kidney failure dog, and stage 4 is not a pretty sight to see. I think the cordyceps would be the way to go, and I would probably give a fairly high dosage of that. For that, there's some studies showing that it's actually beneficial with kidney transplant patients and patients on dialysis. So I would go with that and some prayers. Um, and then Ollie, my dog, has a single FHO, a double FHO, that femoral head ostectomy. That means when there's bad hip dysplasia or there's trauma like hit by car that can't be repaired surgically, we cut off the head of the femur so that there isn't bone on bone pain. And there's just this kind of muscle mass that kind of holds it all together, and you have to watch their weight. At one point in Ollie's career, I kind of got lazy, or our other dog got cancer and stopped eating, and Ollie just ate her food. We didn't know she had stopped eating, and Ollie was like 85 pounds. And so with that single FHO, he really started doing poorly. So with mushrooms, we don't think necessarily that much about pain relief, but they have good anti-inflammatory activity. And I think the cordyceps would probably be good for your FHO dog as well. And you can, because it's so palatable, I would buy the big pouches and use it that way. And for these guys, for their size, probably half a teaspoon to a teaspoon twice daily.
Yeah. And we're so sorry that you're dealing with those issues with both of your dogs. That's got to be really hard.
It is. My gosh. Watching them suffer is the worst thing.
Well, our thoughts and prayers are with you, Jennifer. That best of luck with you. And, reach out if you need support, reach out to us. We're happy to help. We're going to move on to Lynn here. So this one, I think, has a little bit of background to it. If I remember correctly, Lynn, and you can correct me if I'm wrong, Lynn has the Aussie dog, and she has had 2 episodes where she was sleeping and then completely unconscious. Not sure if she fainted or if they are seizures. The other, she collapsed, was conscious and very dazed and confused. And then let me see. Sorry, guys, I got to scroll through comments. Is there anything that I can give to support her? This one sounds pretty serious.
Yeah. And hopefully you're going to see a neurologist. I would suggest lion's mane and reishi for this dog.
Yeah. And she said, no, not an Aussie. Sorry, Lynn. There's so many comments that come in here. Sometimes they just get hard to keep track of. But yeah, hopefully you get with a neurologist. We're very sorry that that's happening. We'll move on here. Let me see. Okay, we're going to move on here. Sorry, guys. I got to go through comments and put them up here on the screen. Okay, this question. Hi, my cat has severe hyperesthesia.
That's what we just talked about. That's FHS, feline hyperesthesia syndrome. So I did answer that before, and the answer was pretty much lion's mane and possibly even CBD for that.
Gotcha. Okay. We'll move on here. So this next question is, what is the best powdered mushroom from real mushrooms to use with chemotherapy to improve outcome for lymphoma, and what dose should be used and in what intervals?
Well, I think the 5 Defenders is great because it's got 5 different mushrooms. I think any mushroom is going to help with chemotherapy, and that's why using 5 at the same time is a real good idea. And of course, we base the dosage, on the size of the animal, and we don't have that information here.
Yeah.
But we have dosage charts buku everywhere. I just recreated some new ones because so you should be able to find that information.
Yeah. Yep. Best of luck with that. We'll move on here. This next question looks like we got about 3 minutes left, Dr. Silver. We'll do a few more questions.
Sure.
Sweet. What types of mushrooms and dosage would you suggest for a cutaneous lymphoma in a 12-year-old Siberian Husky that is 55 pounds?
Again, I'm going to go with the 5 Defenders. Cutaneous lymphoma oftentimes can be more difficult to treat than the B-cell lymphoma where it's in the body. So you want to use a pretty high dosage. So I would start with 1 capsule twice daily and give that for a week, see how they're doing. And then I would go to 2 capsules twice daily and then see how they're doing with that. And then I would go to 3 capsules twice daily. Or, if you, some people don't like the capsules because they're concerned about these inert excipients that are in there that we use for flow factors, which there's a lot of spin on that, and we could debate that for a long time. But regardless, I respect your sense of risk. So you could go with the powder as well. And a large capsule of the 5 Defenders is the same as a quarter teaspoon of the powder.
Yeah. And then just out of my own curiosity, cutaneous, what does that mean?
It's a T cell lymphoma versus a B cell. So different white blood cells of different types of lymphocytes are cancerous. And some types of lymphocytes, when they become cancerous, are more difficult to stop than other types of lymphocytes. There's maybe 20 or 30 different diagnoses within lymphoma of the variations in the different lymphocytes. And we don't have information about and some are more aggressive than others. And the cutaneous lymphoma tends to be a bit more aggressive.
Gotcha. Wow. Okay.
Unfortunately for you, Husky.
Yeah. Would you want to do one more question, Dr. Sover? Or do you want to wrap it up?
No, I'm good.
Okay. All right. We'll do one more question here. Pat is asking, would you add another mushroom product to 5 Defenders for allergies? I was thinking to add Daily Dawg.
With allergies, I think you have to be careful about not doing too much because you never know what might or might not be allergic to them. Daily Dawg has 13 different ingredients in it. It does have the 5 Defenders and lion's mane and cordyceps, and it does have a nice active probiotic in it, which could be good. But I just, it's if I were your vet, I would also recommend caution trying that. I think that the 5 Defenders is plenty good for allergies, but it's certainly not a standalone. There are so many other things that are important to do with an allergic pet. And there's a number of different things that aren't mushrooms. I've written about it. I have an ebook called The Truth About Pet Allergies that kind of describes these things. But I would say, Pat, keep it simple. If anything, increase the dosage of the 5 Defenders versus adding more stuff, just simply because we don't know how your dog as an individual will react.
Yeah, exactly. Hope that helps, Pat. And with that, I just want to serve you guys a reminder that we've got the discount code PETLOVE25 active on our website now, so you can get mushrooms for both you and your pets. I'm going to go ahead and share a link here one last time in the chat so you guys can see it. You guys can it's automatically applied there. Go ahead, shop, use it. 25% off for both you and your pet because we love our pets and we know you love your pets. So hope you guys enjoy that. And with that, thank you for watching. It's been an hour.
Thank you all.
Yeah. Thank you guys very much. And we will see you next month at the next Pet Q&A. Bye.